Hi, I'm Dr. Nishant Yagnick. I'm head of brain and spine surgery in Fortis Hospital in Manesar. So this patient, Mrs. SARITA REGMI, she came to us in a very, very severe condition. She had very high pressure in her brain, which led to blindness in her eyes. Over 15 days, she went from seeing normally to barely being able to see at all. Not only that, in the eyes, when we put light into the eye, there was no reaction from her pupils, so she could barely perceive light. This lady was almost completely nearly blind, and that is why urgently she had to come to us for a very simple and minimally invasive procedure that helped her. So when she came to us, we planned for what is called a lumboperitoneal or THECOPERITONEAL SHUNT SURGERY. In this surgery, thankfully, we don't have to touch the brain at all. So even though the problem is in the brain, we don't need to open the brain. We don't need to shave the hair. The patient has a wonderful recovery. And what we do is, we take a pipe from the lower part of the spine and we take the fluid of the brain and we start transferring it into into the main area of the stomach. This way, the pressure from the brain is reduced over a period of time naturally, and the patient starts to show recovery. The surgery is hardly lasts 1.5 hours, and the stitches that we use are all absorbable, so the patient doesn't even need to get stitches removed. Even after 12 hours of this surgery, the reaction of the eyes of this patient started to improve significantly. Secondly, the patient before the surgery could only see some perception of light in front of her, but now from her one eye she could see more towards the side, which means that she could walk around without crashing into things on the side, and could use the bathroom on her own for the first time in many days. Finally, 48 hours after the surgery, we made the patient walk outside, and I have a video of this. We showed her large paintings that are there in our hospital, and she could recognize in that painting what all things are there, what colors are there, what all structures are seen. We hope that within 3 months she gets 50 to 60% recovery, and within 6 months at least 80 to 90% recovery, which will normalize her life and save her eyes. So with this hope, we hope to serve any patient who has this problem. Please don't think that hope nahi hai, problem bahut badi hai and nothing can be done. At least find an opinion from us, because simple solutions can lead to major answers to your problems. Thank you.
नमस्कार, म सरिता रेग्मी। म चाहिँ 6 महिनादेखि आँखाको समस्या भएर अनि ट्रिटमेन्टको क्रममा चाहिँ नेपालमा ट्रिटमेन्ट गराउँदै पनि त्यहाँ चाहिँ ट्रिटमेन्ट सम्भव नभएको कारणले गर्दा चाहिँ अहिले इन्डियाको दिल्लीमा आएर उपचार गराइरहेर त्यहाँको उपचारमा चाहिँ केही सुधार पाउँछु कि भन्ने आशले चाहिँ हाल चाहिँ अहिले इन्डियाको फोर्टिस नामको हस्पिटलमा ट्रिटमेन्ट गराइरहेको हुँदाखेरि चाहिँ उहाँको गराएर फर्किने क्रममा उहाँको शल्यक्रियापछि चाहिँ आई एम सो ह्याप्पी। म अलिकति मेरो उपचार चाहिँ केही सुधार होला जस्तो महसुस भइरहेको छ। विशेष मेडिगोकेयरका भाइहरूलाई विशेष धन्यवाद। उहाँहरूले चाहिँ हामीलाई धेरै हेल्प गर्नुभयो। उहाँहरूले चाहिँ हामीलाई सुरुमा एयरपोर्टदेखि पिकअप गरेर हस्पिटलसम्म छोड्नुभयो। त्यस पछाडि हस्पिटलको केयरिङ ट्रिटमेन्ट सकिसकेपछि अब होटलसम्म ल्याएर यहाँसम्म अहिले पनि उहाँहरूकै साथमा छौँ। भोलि चाहिँ हामी यहाँदेखि फर्किने तयारीमा छौँ। ओके, थ्याङ्क यू।